But yeah, I literally, like, right before this stream, I fell asleep. And I just got completely knocked out. You're able to take down a sleep and obtain your basic needs. I get my basic needs, but it really isn't a sleep issue. Like, people have said, like, oh my god, my brother is just like, oh my god, you need to stop masturbating. It's because you don't have any goals in life. It's just like, no, I'm pretty fucking sure that, like, it's a physical issue. It's like some sort of illness or some sort of, like, something. But it's always just like, either I've been trying to get, like, as much sleep as I can, eating way more healthier than usual. But it really is just like an issue. But of course, because the problems were essentially caused by the fact that I took some dumbass medicine, either because of antipsychotics or the antibiotics meant to, like, help me with heartburn, gotta say, don't really trust meds anymore. I probably should see the doctor, see what the problem is and whatnot, but, like, I kinda don't want to. It truly is just a money game. The doctors really are not here to help you at all. They are just there to make money. They're there to diagnose problems, but never have a solution. And I also genuinely do believe that there's just nothing good that's gonna come out of believing in the medical system. It's basically already, like, the expense of it and whatnot, and the low quality stuff. People like to whine about a lot of things, but, like, for people who like to whine about free healthcare needing it to be free or whatnot, it's not like they actually provide anything now that I think about it. When you were in the ward, how much brain fog did you have? Way too much. Way too much. I tried to sleep, could not sleep. So much brain fog. In fact, they constantly gave me medicine and whatnot. I also noticed some of the treatment as well by the doctors had sort of changed, so it's just like, that might be it, actually. I highly doubt it, but it would make sense because, you know, doctors these days have to be, like, the funny, politically correct, you gotta respect the genders and whatnot, and, you know, those psychopaths, if they ever get their hands on, like, medical stuff, they don't have the Hippocratic Oath, they don't understand what it means. Well, actually, I could check my, stuff. I could check my notes or whatever to see if they genuinely have that kind of note on me. I don't know if they check it. I know it can't be really spread around, but they could always, but I don't see why on earth they would ever include it, because that would be grounds for a lawsuit. As poorly as I like to word my things, it really is just, they can't really say that, because if you do re-explain, just say it's very petite. Well, I mean, it's not like they want to hear it either. It's not a conversation we'd have with a doctor. I was having a mental meltdown. There's no reason for me to re-explain it. Unless, like, I have to. But I don't see why, because it doesn't seem like the stuff is on there. Alright, yeah, literally. So, basically, I might have dug myself into a hole because of the mental meltdown that I had, because I'm no good talking. Talking sucks. And I don't even feel fully recovered, even after I took a little short nap before the stream. Not sure if I should talk about this on stream and read off my medical notes or whatever, but nothing I'm actually worried about. Because, well, I'm just not concerned. Crowding of teeth, behavior problem in child, depressed mood, dysthymia, current moderate episode, major depressive episode, top prior episode, ganglion, autism, eczema on both hands, elevated alanine, and transferous of dyslipidemia, bilateral carpal tunnel syndrome, fatty liver, pollen food, allergy, gastroesophageal reflux disease, allergic rhinitis. Yeah, no, that's like my problem list. Isn't that fun? And modern medical science can't fix it. Important you are examined and treated on the emergency basis is not a substitute. Infection prevention, suicide prevention, Yeah, notes. Oh boy, that is, wow. 2 weeks notice, because they liked a black singer? What the fuck? What is this? I don't remember saying that. A about a bomb in his PSEO. What is going on here? These are the professionals I'm working with that are taking care of me? Holy crap! What is all this? I don't know what black singer. What? Yeah, no, they were lit. What is this? This is all hogwash. What the hell? There's like, oh my god, I just skimmed through this. Now I'm trying to read through. Wow. Slaughtering everybody? Holy no, I didn't say everybody. I know I didn't say everybody. Oh my goodness. These people, oh jeez. What is this? They literally are making, these people are literally making stuff up. They called a previous school therapist in the past. Okay, so now my high school knows that. History of non-compliance. What is going on here? Non-compliance sticks out. Holy crap. Suicide attempts? Loaded OD in the past? That wasn't a suicide. Oh my god. Non-compliance is me not setting up an appointment to talk to him. I'm guessing they mean it in the professional way, but what is this crap? Half this stuff is made up. Most of this stuff sounds way worse than it is, so I'm giving it the benefit of the doubt and thinking it's not as bad as it sounds. But wow. Oh wow. Holy moly. I went to the doctor's ordering for eye problem, mental health. Oh yeah, I didn't even get like a proper answer for that when I visited the doctor. So my eyes are just completely screwed. Due to putting pornography online. Mm-hmm. It was hentai, but I didn't want to tell them. When I was in my... Okay, so these people are... Okay, what is this? Was I just not clear, or did they just not care? What's that stuff on you, right? I don't know. What is this? Holy... What? These are the... Holy fuck... God, I didn't even... This wasn't even on... I didn't check this. Oh my god. He took antidepressants after? That's not what happened! After? What the fuck is going on? This is all full of, like, misinformation, twisted information. Like, it's interpreted in the worst way possible. What is this? Recent past week diagnosis, e.g. cancer, HIV, AIDS. Yeah, no, I don't think so. Hope for future? Nope. Attachment to life? Yes. Alright. Responsibility to children, family, or others, including pets who client would not abandon. Yes. Who? These people don't even know protective factors that I have. Attached to therapist, counselor, or other service providers? No. No shit. Yeah, I'm not afraid. No, I'm not. Nope, I'm not religious. Nope. Over-report risk. Over-report risk. No, but they still misreported anyway. That's amazing. Those are protective factors. I'm guessing it's an analysis of, like, what's keeping me alive. And literally everything on there should actually just be just no. Hope for future, no. Responsibility to children, family, or others, including pets who client would not abandon. That should be a no, actually. Embedded in protective social network or family? No. Attached to a therapist, counselor, or other service provider? No. Fear of suicide, death, and dying, or not acceptable method available? No. Fear of social disapproval of suicide? I am not afraid at all. Highly spiritual, religious? No. Demonstrates reliability in personal and professional life? Reliability. I'm pretty sure that should be a yes then. People rely on me way too damn much in work. Way too damn much. I don't know why the heck that's a no, but I wouldn't mind abandoning them. No, I hate my workplaces. Not gonna lie. It was just like that. Client motivated to over-report risk? No, I'm always constantly honest. I try to be as honest as possible and try to disclose things to the best of my ability. And if people misinterpret it, that's on them. If they don't ask questions and presume the worst, then screw them. Is there current harmful ideation towards others? Lethal means? Nope, nope. How have lethal means been addressed? How have lethal means been addressed? Yes. What is... Alright, I'm not gonna question how they answer the questions, but there is information which is just complete bullcrap. Are there any other medical concerns? Eye irritation. No, I'm pretty sure I talked about my hands being... Ironic how you were being honest to them, but they weren't. Yeah, literally. What the hell? Also, I had carpal tunnel during that time, but I didn't get the help that I need because even though like my hands sucked, which is funny. Substance abuse, no. Withdrawal symptoms, no. I've assessed current crisis management skills, increased crisis survival behavior and problem solving, focus on crisis intervention or problem solving that fight events I have set off current. You take some suicidal, no meds, no support, and no outside providers. Yeah, pretty much. Based on risk assessment, a bomb threat to my... That is not what happened. It wasn't my... Oh my god. Christ. Now I want to see my FBI report. I don't know how disgustingly wrong it is. That's what I want to know. If it isn't like full of like, you know, oh, this guy's like a super risk factor or whatever. That's what I actually want to know. I want to actually read the record of... I want to see the report and just how botched up that report could be. Because if this is professional within the medical field, I can only imagine how incompetent, like, the legal field is. Like, I want the art... I want, like, literally the sheet. I want the disclosed information and what they have on me. I want to see what they wrote and just how much it's just, like... what on earth could they write? Like, judging by like how the hospital, how my like medical services literally have misinterpreted literally everything and anything and have done all this stuff, it's like, I'm pretty sure like the FBI on my sheet is like, this guy is a serious threat. He has like all the skills. He is self-proclaimed like super genius, super like psychotic. He is an imminent threat, drug addict, or something. Breaking news, I tell you, wanted for every crime. Yeah, literally. Oh my god, this is the professional, this is what the doctors wrote. And these people are supposed to be taking care of, like, people like me. And I was going through a crisis, a mild one. I didn't, like, jump out into, like, a river. God, I still remember that dude. I don't know his name, I just heard his voice, and it's just like, oh god. Someone actually did that? I don't know what the hell went in his life, but I just hope that he's fine now. After everything that happened to him. But what is all this? Holy frick! Should I tell you is the true acronym for 4chan? Oh yeah, no, I am 4chan. Oh my god. Recommendation admission, transfer option metro only, color guidelines red, key factors during color choice, HI with active color guidelines? HI with active color guidelines red. I'm gonna know what that means. If there's like a medical thing to it, I might just like... Discussed, yes. Have you informed patient when units at the rooms? Patients are assigned a room based on self... Pardon? So wait, if I had identified as female, I would have been paired in with the girls then. Well, thank god I identified as a dude then. Fuck. If I had to... Ugh. No. Color codes. Hospital emergency codes. Race. R stands for rescue, A stands for alarm, C stands for close, E stands for extinguisher. Code blue is the most common one when a patient is experiencing chest pain or is in cardiopulmonary arrest. Code white, if we talk about code white, it's mostly similar to code blue, which focus on child emergencies. Oh, I see. That's interesting. It is used when we need a mass evacuation due to a poisonous gas leak. Code orange. Oh, shoot. Wait, then how on earth do you use the codes, then? Do you, like... How do you declare codes? Do you just tell, like, a doctor? You, like, if I was... So what would happen if you did identify as female? Then I would have been... I probably would have been roomed in with other females, then. Which... I mean, the females at my hospital were, like... I don't want to say that they were particularly... You know, they were bad-looking, but... To my aesthetics, no. They were ugly as fuck. So... no. Code yellow for bomb blast. So how on earth do you even declare the code? So like if I'm working in a hospital and some random doctor shouts, "Code Orange!" What like, if I... No, actually, no. Imagine being a janitor, and you're just sweeping stuff, and then one of the doctors just... There's like a doctor running down a hallway, just like shouting, "Code Yellow! Code Yellow!" And everybody's running, and you're just like, what the hell's going on? What? You're just randomly going around. What does Code Yellow mean? Code Gray, used for some kind of a violent attack by any person. Code Silver, used for an alleged active shooter in a hospital. Oh, shoot. I don't think I've ever heard that before. So, wait. So, if I'm a janitor just brushing, and then the doctor runs down the hallway shouting Code Silver, do the janitors at least know what's going on? Like, do the janitors at least know what the codes are? Like, if a doctor comes down shouting, like, Code Purple, used when a lockdown is being implemented, or Code Brown, used when external chemical spill, or something, what am I supposed to do? Code Yellow, do I need a monitor? Oh, yeah, no, probably. That's code Yellow for the janitors. Code Clear, to inform people that the situation is under control. Code Red, Fire. Alternative, massive postmortem hemorrhage. What is almost all this? Different codes are used in different hospitals. Code Blue, variations, doctor codes, resus codes. Oh, right. I said, I'm gonna transform your anus into a kangaroo with your anus wrapped around it. What? Is that a fetish thing? But that seems to be the end of the thing. Some guy named Hand Sanitizer Man commented, I'm gonna transform your anus into a kangaroo with your anus wrapped around it. I'm Kim. Wah ha 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 ha. Face orange, frowning face front. What? Kim. Okay. Who's Kim? Patient is currently involuntary and would like to go inpatient. Okay, this could also be to do this ASD, but you know, getting diagnosed with trying to find out if I have like something like dementia is incredibly hard to do because depression's in the way. But we don't attribute it could be. We just, we just assume it's like mental illness or whatever that is. Okay, that's amazing. That's amazing. This entire system is actually completely screwed up. Patient was also banned from the Anime Arts Online competition program. There's this... What is this wording? What is this, dude? Oh my god. He said his mom and dad are more traditional medicine in the past. My mom and dad are traditional medicine in the past. They were more traditional medicine in the past. My parents are traditional medicine. Okay, this is how on earth do people read this? Aside from like the stupid writing and the cuckoo writing, what is this? What is this? Acute risk factors. Yeah, pretty sure we've seen that. Patients are running the ward at the point. Yeah, no, literally. In fact, the mental wards are literally underfunded too. So it's like, it's all run by donations, by the way. The hospital does not put any funding into like mental health or whatever, so... Progress notes, okay. Has not been in strains. Okay, that was actually on the table. That's interesting. With aid of interpreters, spoke with my mom. He says a lot of things and may not mean what he says. He's indicated he's obsessed with the computer internet. He doesn't listen to her. So I hope that he's not given medication, treated only with psychotherapy. He accepted that the professionals had overall safety concerns. Chart reviewed. Patient is okay. This is 2-7 per writer's note on 4/27. Okay, is this a repeat? This looks like a repeat. This, okay, seems like it's just repeating itself multiple times in a row. Hypertension, stroke, maternal grandmother, stroke, paternal grandmother, good health, maternal grandfather. Good health is a problem? Okay then. Hypertension, paternal grandfather, hypertension father, thyroid disease father, alcohol, drug, no family, and all that, okay? Patient is currently a voluntary admission. Because of his history of homicidal ideations, him not wanting to discuss it during assessments or go into details of his plans, writers feels he could be a danger to members within the community. If patient requests to leave, a 72-hour hold will be placed along with a petition for with the county. Okay then. Him not wanting to discuss it during assessments? Huh? Wait a minute. No, I literally described the plan when I was talking to the doctors. I was just like, yeah, I just used the thing. What? Do I have to write out a manifesto in order for it to count as, like, specific detail? Okay, then. These people are genuinely stupid. These are doctors? Okay, then. You know what? I want a PhD in medical sciences. I'm gonna make my own, actually. Like, literally, if these are the doctors who literally have to take care of me and write all these stupid things and make no sense whatsoever, make no logical sense, and do not have anything that seems to relate to reality whatsoever, yeah, no, I'm making myself my own PhD. I do not care about the fact that I haven't went to medical school, because if these people went to medical school and they got like a bachelor's or whatever, no, I'm a doctor now. I'm calling myself Dr. Ninja 8 Taiyu from now on. Alright, I have a doctor in my name now. I do not care. I'm owed it now. Holy crap, these people suck. No, I deserve it. Like, holy crap, what is going on? What is this writing? It's so crap. It's all so crap. Who did these people pass English class? I want to know. Like, I know you're supposed to look. No. When I took an engineering, when I looked through my engineering career path, all the classes and the credits I have to earn, writing, and I had to do like intense writing as one of the electives. I didn't get around to it. I actually did take on one of the courses to try and cover it on creative writing. I wish I had done better, honestly, but it doesn't matter. I'm learning to, but yeah. You with the medical expertise literally gonna become, I am a surgeon guy, but better. I don't even know what to say. I feel like I could, well, no, actually, because I don't have the anatomy knowledge or whatever, I could probably help out, like, provide, just hand tools over. Just learn the quick tips and tricks or whatever. I could, like, here's the thing, I'm a fast learner, put me in the job and just tell me what to do, get me used to it, and I'll just get into it. So, honestly, I could learn surgery if I was in the field myself. I learned how to dress it, the codes and whatnot, just how it works. It's theoretical knowledge. Like, I probably wouldn't be the guy who's actually doing it. But if I had to, and if I learned to, I probably could. I'm not even kidding. That's just how smart I was as a kid. And even though my brain's kind of fucked up from all the medicine they gave me, I could still, I honestly would take a bet. Like, I would say I would be able to essentially, within a hands-on experience, I'd learn everything that I would need to, given that they are actually willing to teach me, within a month of on-field experience. Like, that's the bet I'm willing to make. A month at maximum. I'm actually willing to bet that I'm able to get it in, like, 2 weeks. I get, like, 60% of everything down by the first week. But yeah, no, holy crap. Has the patient requested additional privacy or have concerns about privacy? Yeah, no, I don't care. Color guidelines read, key factors in determining color choice, autism with increased aggression. The scariest thing, autism, but increased aggression. What do you think the patient needs? My brother states, I honestly don't know, he's quite good at masking feelings. Okay. His patients made comments about wanting to kill, not others, but something he's saying, my husband thoughts about hurting himself and work is the biggest stressor for him. If DC is recommended... What? Okay, what the hell is DC? D/C. Yes, he can go home with his parents. I just brought my son to the clinic this morning, and over an hour, he doesn't talk to me or listen to me at all yet because you're a pathetic mom. He was in college, but he quits as he wants to earn money to work to save money. He's mad at me since I didn't save for his college, and I told him to just apply for student loans. Otherwise, he's always on the computer and he doesn't talk to me, but he will talk to his brother. Oh yeah, because you don't know. What do you think the patient needs? I don't know what he needs since he won't talk to me at all. That's because you're annoying. You don't provide anything useful. You repeat the same stuff over and over again. Holy crap. She still doesn't get it. That's why I don't respect her at all. And it's so... Like, the doctors respect my parents more than me, even though I'm more capable. I can't believe this. I genuinely... What is this? Oh my god. He did talk about it in the past, but I haven't heard him recently. Oh wow. Soon loads, what a joke. That is pain. Yeah, literally. Tried calling patient's dad, and he states, talk to my wife, I don't speak good English. Oh, past month. Oh, well, yeah, no, I don't care about that. I probably misinterpreted the questions again. Meh. Psychiatric behavior, positive for sleep disturbances and suicidal ideas, negative for self-injury. Yes, sleep disturbance, and they still couldn't solve that. Sleep is the main important thing for mental health as well, and they still couldn't solve it. They just gave me, like, meds, which made it worse, honestly. Someone mistyped anime with 2 E's. I'm just looking through it now, since I'm looking for, like, specific things now. I've been doing it for a year now, don't judge me, man. I missed a lot because I'm just skimming through. Most of this stuff is just padding and stuff I already know. But the things that surprise me is just the fact that they get so much of it wrong. What is all this? I'm gonna clip this, actually, and I'm gonna turn it into, like, a literal clip of me just talking about, like, me reading through my my freaking psychiatric visit there. Because, here's the thing. The meds, when I literally, like, I try to resolve, like, some diarrhea issues and all that stuff, and then it's just, wow. Them elaborating on the anime part must be almost as ridiculous. Well, I mean, I don't know. I'm not sure what to say about that, actually. Like, I didn't even think about it. It's just boomer talk to me. Like, I don't know. Do they... I'm guessing they might... They you know, there's, like, still a bit of a stigma, in the professional fields that anime can cause, like, violent tendencies and all, like, it causes violent tendencies, suicidal ideation, whatever. So, like, anime is, like, code super red, like, code aka or some shit. Akai. Kodo akai. Very, very bad. Honto mazui desu. You know? Yeah, no, so, anyways, you know what? I'm adding doctor to my list of things. They see anime, they see Coomer, they see the catalyst of all human evils. Watching anime turns your children into supercharged serial killers. It is like, it was made by Satan himself. Anyways, yeah, no, I'm adding doctor to my name. I'm adding a doctor to my name. I will gladly be referred to as Dr. Ninja, Dr. Wolfie. I will take pride in the fact that I have done more to help the people around me than the doctors have in centuries. You know what? Actually, it might just be recent times. Things have just started to decline. You know, empires in their lifetimes. It's probably just that. So... Reader, philosopher. Well, I'm not gonna put Slapper anymore. I'm a doctor. I'm a creator, philosopher, and doctor. Yeah, no. So if anybody ever asks me, why do I have a doctor in front of my name? That's why. Holy crap. Like, here's the thing. I'm not gonna criticize how they format everything and the specific terms and what they mean, but the fact they got all these events wrong seem to take my mother more seriously, even though I'm literally a legal adult. I've already proven so many times, even through as a kid, that my parents are genuinely incompetent. The fact that they value their opinions more than me? No. Sorry, but they aren't professional. If they can't trust the patient to properly express the things that they want to, even though they come to seek help, even though they try their best to do better. Sorry, but no, I'm better than the doctor. I should be calling myself something better, actually. Honestly, they shouldn't be calling themselves doctors. I have more of a right to call myself a doctor than the people who are actually trying to take care of me. And that's actually incredibly pathetic. So that's amazing. Anyways, I'm gonna end the stream and try and clip all that. I'm gonna have to cut down all the silency parts and whatnot, but... And I don't know if I even want to edit it. It's like I have to scroll through all of it again. just to like make the screenshots and just to like give the visualization. I don't want to do that. Like, I don't want to. But yeah, no. Holy crap. I might continue my... probably... It's like 1, 2 a.m. now. But holy fuck. That's the... That's medical... That's... These are the doctors that are working in the clinic that I visit, that are responsible for other patients and not just me. And be safe then. Alright. Have a good day, everybody, and I'll just keep quiet for a bit because, again, Stream.io likes to cut, like, there's a, like, the stream is slightly delayed, and when I end the stream, the part between the delay and the time I end the stream, it just cuts all that out. So I'm just gonna pad it with silence again. So, yep, that's gonna wait. I'm just gonna scroll through for like maybe 4 minutes, and then I'll end the stream, and then clip all this. This is gold. This is gold. I am better than Doctor. I am better than Doctor. I am an actual doctor. I do not care anymore. I literally have more qualifications. I refuse to accept that they have more qualifications than me after that. Like, literally. Literally. Nope. Not gonna happen. Not gonna happen. Nope. I'll gladly take that with pride. Thank you. Well, actually, you know what? I should probably note that maybe it's just the doctors that I'm seeing who are genuinely incompetent. Maybe if I try harder to find a good doctor, maybe, I'll actually get the help that I need, but, no. The current ones I have are probably very, very, and the fact that I saw all those people, it's kind of like, yeah, no. It probably is just a needle in a haystack kind of deal. And I should really stop talking. I want to clip all this. I will clip all this. Actually, I'm recording this after my stream rant. However, I wanted to also note that as I was always, whenever I always visited the doctor's office and always had to like talk with them or do whatever, they always seemed to constantly assume that because I was Chinese national, they assumed that I always needed an interpreter. Despite being raised here, I can talk very fluently in it. It's just like, you know, they presume a lot of grammatical issues with how I speak and misinterpret almost everything despite my specific wording. And in fact, I don't believe it's a matter of miscommunication than it is them being... Honestly, they might literally just be racist. Like, they might be the, you know, like, oh, hey, we care about your gender identity and your race or whatever because, you know, your racial identity is important or whatever. No, that's not what's happening here. That's not what happened there. They genuinely believe that I'm too incompetent to even talk and say how it is. So, honestly, it's not miscommunication. It's not getting the facts wrong or the fact that it doesn't matter. Because here's the thing. You need the facts in order to properly help patients. You need to truly grasp the situation. You can't solve a problem you don't properly grasp. If you don't know what the problem even is to begin with, then you can't even begin solving it. And these people, these doctors that I had to be with, I realized it now, but the fact that these people can drop all these misinformation, misinterpret everything, they don't clarify with the patient at all. They rely more so on third-hand, just my parents, my family, more so than my own word. My word cannot be trusted, and so my own problems are completely dismissed, even though I clearly have them. And even when other people agree, it's just not that. So, it's not that. It really is not that at all. So, no. The entire medical system is incredibly corrupt, or at least my sector is. I don't know if there is good doctors there or whatever, but no, I just don't trust him anymore. I can't. That was so dog crap awful that, like, it was unprofessional. The writing was full of mistakes and errors, and here's the thing. Although it technically shouldn't matter, because the thing that should matter is trying to solve the patient's issues. And, I do admit, again, there are misinformation. Just you can't always be fully clear about, like, what happens. And, it's bound to happen, but it's not always a massive issue. However, that's not what happened. That is not what happened whatsoever. It's been, like, an entire issue for... I don't even know. I don't know what to say, because, like, that is just, like... I'm just, like, still, like, I'm still trying to process that, because, like, it's just, holy moly. I just don't know what to say, like. They have to do is listen to me and help me with their expertise with all the problems that I have. And, they can, direct me to mental health specialists, but... that is not what happened whatsoever. They really did not. So, yeah, I do hope that you guys might have enjoyed this very, very interesting revelation. Because I don't know what to say, because, like, I don't think there's a proper excuse. Like, we could chop it up to incompetence, but that's not good. We could chop it up to, malice, but that's even worse. And if we're trying to say that it doesn't matter, it kind of does, because they're the ones who's giving me really crappy medicine, which doesn't work, and they acknowledge the issues, and yet they still don't try to solve it, even though they claim that they have the medicine to kind of properly help by, because of my brain, the chemical imbalances in my brain by, so basically I have a chemical imbalance in my brain, and to fix it, we just chemically alter your brain more. When you think about it for what it actually is, surprisingly, the simple solution like that kind of nudge does not work. And I've already seen plenty of experiences with other people who have dealt with antidepressants and simply did not do good with them either. So... this is Dr. Woofy signing off. And I will be calling myself a doctor from now on. I am a doctor. And, the reason why is just to be mockery. Honestly. I do not consult me with medical advice. I will just be using Google, but honestly, I might do a better job in regards to that, just by using Google, than actual doctors in this day and age. So I don't know, maybe consider me a doctor or don't, doesn't matter. Either way, I believe I'm more superior than the actual doctors these days. So yeah, if you want to prove me wrong, find me an actual good doctor who's willing to solve my issues and actually can. But until then, I'm a doctor. Better than, I'd say, about 80% of the doctors in this world, honestly. That's probably a good guess, honestly. Yeah. No, I'm confident in myself now. Way more confident in myself now that I know that I'm literally, like, the literal doctors who have to be, like, super intelligent and all that still suck. So, no. And again, I'm signing off. I should stop ranting. Unfortunately, despite being a doctor, I can't really solve my own issues. Interesting how that works, huh? But, hope you guys enjoyed that crazy thing. Again. And I'll hopefully see you in the next video. See you later!